Further remarks, the good member from the 20th, Representative Abbarno.
Thank you, Madam Speaker. I'm urging a yes vote on this amendment. This is a good amendment because it doesn't just deal with science. It deals with clinical data. It deals with providing evidence-based, but clinical data and the side effects in actually disclosing it. I don't disagree with what has been said on this floor about the fact that, when we're talking about vaccines and treatments, that we are treating an individual who has an ailment or a certain condition. But this is about new and emerging treatments. This is about making sure that our public health officials are actually sharing side effects, that they're talking about the clinical data. Not every condition, not every disease is the same. Not every vaccine is the same. And we can't talk about COVID-19 and gonorrhea. They're very different. We can't be talking about every disease and just assume that it's the same. This goes directly to the fact that we need to make sure that when we have public health officials talking, they're talking about the side effects. They're talking about clinical data. They're disclosing this information to people, not just saying science, but the data. This is a good amendment, and I'm urging its passage. Thank you, Madam Speaker, and good evening. We have heard about divisions of government and the different branches, and so I think it's important to kind of go back to the early 1900s when Jacobson v. Massachusetts was decided, which was a foundational decision regarding the authority of public health matters on whether or not you can actually restrict some individual freedoms for the purpose of preventing harm to the community. And I think that's important because it could limit but not fully exclude, and it has to be reasonable, and it actually has to be to prevent harm from the community. And looking back now, we can see that over the past 5 years, we've found out that it wasn't. COVID vaccines weren't to prevent harm to the community. And since Jacobson, there's been a line of cases that have interpreted what that looks like. What does it look like to limit but not fully exclude? And in, I think, the more recent years since COVID and the pandemic was declared, science and medicine, as well as, frankly, common sense, has called into question both the decisions of many public health authorities as well as unilateral government mandates. The moral and ethical concerns, Madam Speaker, have magnified this exception. Madam Speaker, we're different. We're all different. Our neighbors, when you go through your community, we look different. We have different races and ethnicities. We have different religions. We have different philosophical beliefs. We have different medical conditions. And the good thing about many of the court decisions of recent is that they're tipping the scale back to some balance, a balanced approach that considers more the personally held beliefs against forced versus the forced vaccinations and the forced medical procedures. And I think that's important because it's a recognition that we're different and that one vaccine for one disease can have a huge impact, a very detrimental impact on different people because we're different. Personally held beliefs are a fundamental aspect of individual autonomy. And even more so with this amendment, and may I read the effect statement?
The member has 13 seconds remaining.
Well, then I won't read that. But more importantly is that it's about parental rights as well and protecting the autonomy of our children. Please vote and adopt this amendment.